Mr. Randall, please read the title of Senate Joint Resolution 007.
Senate Joint Resolution 7 by Senator Moreno, also Representative Kraft-Tharp, concerning designation of the first full week of May as Tardive Dyskinesia Awareness Week.
Oh, you can sit.
Representative Kraft-Tharp.
Okay. She just recognized you.
Do it. What am I doing? Asking that to be read at length.
She recognized you already.
Can I request that it be read at length?
Sure.
Thank you.
Whereas many people with serious chronic mental illness, such as schizophrenia and other schizoaffective disorders, bipolar disorder, or severe depression, require treatment with medications that work as dopamine receptor blocking agents, DRBAs, including antipsychotics. And whereas, while ongoing treatment with these medications can be very helpful and even life-saving, for many people it can lead to tardive dyskinesia, TD. And whereas many people who have gastrointestinal disorders, including gastroparesis, nausea, and vomiting, also require treatment with DRBAs. And whereas treatment of gastrointestinal disorders with DRBAs can be very helpful, but for many patients can lead to DA. And whereas TD is a movement disorder that is characterized by random, involuntary, and uncontrolled movements of different muscles in the face, trunk, and extremities. And whereas, in some cases, people with TD experience involuntary and uncontrolled movement of the arms, legs, fingers, toes, tongue, lips, or jaw, swaying movements of the trunk or hips, or impacts to the muscles associated with walking, speech, eating, and breathing. And whereas TD can develop months, years, or decades after a person starts taking DRBAs, and even after the person has discontinued use of such medications. And whereas not everyone who takes a DRBA develops TD, but if TD develops, it is often permanent. And whereas common risk factors for TD include advanced age, alcoholism, substance abuse disorders, being postmenopausal, and mood disorders. And whereas a person is at higher risk for TD after taking DRBAs for 3 months or longer, and the longer a person takes DRBAs, the higher the risk of developing TD. And whereas studies suggest that the overall risk of developing TD following prolonged exposure to DRBAs is between 10 and 30%. And whereas it is estimated that approximately 500,000 individuals in the United States suffer from TD.
Representative Kraft-Tharp.
Thank you. Mental Health Awareness Month is the month of May, and this resolution declares the first week of May to be TD week. Tardive dyskinesia is relatively unknown and often mistaken for other disorders that might have similar symptoms. We as legislators and citizens continue to work to lessen the stigma around mental illness and want to ensure that people are getting the medication and help they need. Once care is established, we want to provide information about the importance of patients staying on their treatment plans.
Representative Michelson-Jeannet, and could someone actually move the
Yes, thank you, Madam Speaker. I move Senate Joint Resolution 007.
Please proceed.
We want to encourage patients to stay informed and communicate with their healthcare providers about tardive dyskinesia. We don't want TD to ever be a reason why someone would not take their medications. And with that, I ask that we declare the first week of May Tardive Dyskinesia Week, recognizing our fellow Coloradans who not only are facing mental illness, but also this movement disorder.
Is there any further discussion? Seeing none, the question before us is the passage of Senate Joint Resolution 007. Representative Kraft-Tharp.
Thank you. I ask the morning roll call be added on as co-sponsors.
We need to move I need to ask for approval of the motion.
Okay.
All those in favor say aye. Aye. All opposed say no. House or Senate Joint Resolution 007 is passed. Representative Kraft-Tharp.
Thank you. I ask that the morning roll call be added on as co-sponsors.
Seeing no objection, the morning roll call will be added as co-sponsors. Majority Leader Garnett.